Dr. Dustin Feldman here from Pulse Cardiology to talk about cardiac catheterizations. So what is a cardiac catheterization? So these are procedures that we will oftentimes perform on patients when we're trying to observe evidence of significant blockage within the arteries of the heart. And a lot of times these are prompted by symptoms or abnormal testing, such as stress testing. Next to me, I have a picture of what a blockage in your heart might look like. With respect to cardiac catheterizations, the question always is what to expect. What am I going to be going through? So the procedure itself is referred to as a minimally invasive procedure. It's involved using little catheters that we access either through the artery in your groin or through the artery in your wrist. During the course of your time at the hospital on the day of your procedure, you can expect to undergo an intake process that usually takes about 60 to 90 minutes. The procedure itself generally takes about 60 to 90 minutes, depending on what is found, and your recovery is usually short. Should you have blockages that require fixing, you may have to be held overnight for observation. Otherwise, you will likely go home the same day. The risks associated with cardiac catheterization are risks of bleeding, potentially infection, or kidney injury. These are minor risks that don't occur commonly. And again, to prevent these types of risks, we use a sterile technique. We provide the patient with IV fluids before, during, and after the procedure. And in addition, we monitor closely for any bleeding-related complications. The procedure itself is generally straightforward. Again, we're injecting IV dye or contrast through small catheters and filling the arteries of the heart and essentially looking for evidence of plaque buildup. Should you have significant plaque buildup, depending on the number of blockages and their location, options for treating these blockages include stents, which are little pieces of circular metal mesh that are inserted inside of the catheters, or cardiac surgery. Again, the decision for treatment is made based on what is found during your heart catheterization.